think one of the things that's so exciting right now in the whole field of patient experience and patient-centered care is how the evidence, the scientific evidence base, is coming together with what we've always felt in our hearts about the importance of compassion and empathy, and that these are things that nurses in particular bring to the patient experience. Now we have the scientific evidence that is showing us that that human relationship, that kindness and empathy actually impacts the healthcare outcomes of the patient. So we're finding that there's a relationship between better patient outcomes and the relationship between the patient and their clinical team. And so that to me is very exciting, that we're bringing together the science and the art of medicine and nursing, and in a way that can be very powerful for improving the patient's experience, but also improving the experience of the staff person. Because many people, when they go into healthcare professions, they go because they want to help other human beings. And so now we're seeing that that helping spirit has real power to improve health outcomes. I think an area where we're seeing a lot of new focus is on a principle that we call co-design. And co-design is where nurses and other members of the clinical team work directly with patients, families, to design healthcare delivery processes so that they not only reflect the best scientific evidence, but also they are very personalized to the human experience. So an example would be in many healthcare organizations now, they are bringing together what we call patient-family advisory councils. And these are groups of patients and families from the community served by a particular healthcare organization, and they are asked to have input into different things that we design. So for instance, we may be creating a health education program for people with diabetes. And in this model, we would bring people with diabetes in who would meet with the nursing staff, and they would talk together about what's most important to focus on. How can we help people manage their diabetes from the very practical perspective of the patient who has the diabetes. So this idea of co-design, of bringing the people that we're trying to help into the actual development and design of the delivery of care. So this is a new concept. It's getting a lot of support in different parts of the world. We're actually now seeing, for instance, in the United States, at the very highest levels of our government, we've created a patient-centered research outcomes institute. And researchers are asked to develop programs and ideas that they want to explore, but they must involve patients in designing the research protocol. So this is a way, again, of bringing everyone together, everyone who's impacted by healthcare, the patients, their families, the nurses, the physicians, the researchers, in designing the important questions that we want to examine, and then involving patients in the execution of that research as well. So this is, to me, very exciting. I think that nurses have always had a very special place in the delivery of health care. They have both the clinical training, the scientific training, but also they have the spirit and the intention to connect on a very human level with the patients and the families that they work with. I think nurses have known intuitively that that relationship is a part of good practice, of good healthcare practice. And so I think that what we're learning now from the scientific research is in many ways reinforcing what nursing has always known, that that human relationship is the very core of the healing experience for patients.